Hey, it's Scott. And for the last couple of days, we've had the pleasure here in Las Vegas of playing with Sunrise Children's neonatal and pediatric ICU transport team. And with that, we're going to now be introducing you to Jared, who is one of their transport respiratory therapists. And what we want to go ahead and quickly touch on in this Give Me Five is the whole idea of bagging babies. But more importantly, not just bagging babies, it's bagging babies with a traditional bag at, let's say, 50 times a minute versus using some sort of a high frequency ventilator and going from 50 times a minute to 500 times a minute. Can we show conventional?
Yeah, sure.
So, little fetal pig, we've dissected out the lungs. And here we've got our little tiny 3.0 tube sitting in the airway. And Jared, if you know what, let's go ahead and just show regular bagging at a rate of like 70.
Sure.
So here, where you just have regular bagging, you see again, you've got air going in and air going back out. But there's a pretty significant difference between going pretty much flat to now inflated and then back down again.
All right. Now, to contrast that, we will put the baby on our high frequency ventilator. We typically run rates of about 500 breaths per minute on this.
Literally 10 times what you were giving breath minutes ago. Now we're going to jump from 50 to 500. So simply at first glance, having played with patients on this for years in the say, but for many people, this is the first time you actually get to see it from the inside out. And the more of the story is, you can see that, again, we have the wibble wobble of the lungs going on. But Jared, if you could, why exactly would you want to do this?
Well, essentially what you're doing, the idea with high frequency ventilation is you're delivering much lower tidal volumes at a much higher rate. Studies have shown that, especially in the premature lung, this helps decrease the incidence of ventilator-acquired lung injury. These little premature lungs, they don't have a lot of compliance. They're very delicate. We have to be very careful in how much pressure and how much flow we put into them. This device allows us to, again, deliver much smaller volumes while still maintaining an adequate mean airway pressure at a rate of, upwards of 500 breaths per minute, as you become a incendiary.
So instead of giving 50 big breaths, you're literally just
we're giving 500 small,
really tight. The other thing that I personally noticed is when you saw before when we bagged, you went from flat to back down flat. But what's kind of neat is when you see them here, it's like they're always inflated. I mean, they have a little bit of decrease, but otherwise they tend to be inflated. But at least my first take would be that's actually a good thing, because now if you're inflated, then you actually have the ability for air exchange to go in and occur through these inflated alveoli.
Correct.
As we touched about during the break before we started this, especially in your little ones and everything bad is respiratory. And if it's not respiratory, it's probably respiratory. So with that in mind, when you've got tiny lungs that are seriously stiff, it's going to take a whole lot of pressure to make those lungs actually go in and out, and you can beat the heck out of your lungs, and your other option is the baby's going to die.
Right.
Or if you've got the capabilities and you fail traditional ventilation, then if you've got your toys, you can go ahead and go from 50 to 500 and achieve the same effect, whereas you happily get air going in and out, but with a whole lot less actually blowing the lungs apart.
We've been using high frequency in the NICUs for a very long time, and the ability that we have to do it on transport just makes it that much easier to get the patient safely from point A to point B. So that's what I'm doing.
Jared, thanks so much, babe. We totally appreciate it.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.